Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks, do people with borderline personality disorder cry more than people that do not have the disorder? I've also seen a number of other kind of related questions to this. Is crying frequency in borderline personality disorder different than other personality disorders? And generally a lot of questions really asking, does crying point to borderline personality disorder in some way? So is it useful diagnostically or clinically? If somebody's crying, does that really tell us anything potentially about the probability that they would have borderline personality disorder? So I've used a few references for this video, and I'll include them in the description for this video. And I'm going to cover this in a few parts. I'm going to talk about briefly what borderline personality disorder is, and then look at the nature of emotional crying, and then talk about the specific findings from this one study that looked at this question. And really the findings were quite interesting, and I think a bit unexpected. So first, I'll start with borderline personality disorder. Well, we see that this is a mental disorder in the Diagnostic and Statistical Manual. Specifically, it's a cluster B personality disorder, which is the dramatic erratic cluster, and is characterized by 9 symptoms. And 5 are required for a diagnosis, and of course a diagnosis can only be made by a licensed and qualified clinician. So we see frantic efforts to avoid abandonment, an unstable relationship pattern, identity disturbance, so difficulties with self-image, impulsivity in at least 2 ways that could be self-damaging. We see suicidal behavior, affective instability, and this one is going to be fairly important here for this discussion on crying, chronic feelings of emptiness, inappropriate or intense anger or difficulty controlling anger, and the last symptom criterion is paranoid ideation or severe dissociation. Now in this video I'll also be comparing crying behavior in borderline to other personality disorders, specifically the cluster C personality disorders, but I'm not going to go through all of the symptom criteria here. I'm just going to list the disorders here. So cluster C personality disorders, there are 3 disorders. This is the anxious fearful cluster. We see avoidant personality disorder, so somebody who has kind of a fear of rejection in social situations and other symptoms. Dependent personality disorder, where somebody really looks for support and they have a lot of anxiety about not having support. And obsessive compulsive personality disorder, which kind of centers around perfectionism and some other kind of rigid thinking features in the disorder that makes somebody highly productive, but they also have a lot of anxiety and concern about not being productive. So again, I won't go through all the symptom criteria, but we see those are the cluster C personality disorders that were compared to borderline personality disorder in the context of crying behavior. So what we see here is that individuals with borderline personality disorder, I'll call them borderline clients from this point on, just for the sake of expediency. Borderline clients are typically portrayed as being emotionally unstable or hyperreactive. So emotionally unstable, of course, would tie back to affective instability, and the hyperreactivity could also tie to that affective instability, but you could also see it could tie to anger, impulsivity, suicidal behavior, frantic efforts to avoid abandonment. So hyperreactivity could link to a few of the symptom criteria. So with this typical portrayal of borderline clients, mental health clinicians come to believe that affective instability is really the best symptom criterion in terms of being able to differentiate borderline clients from other clients. So affective instability can really play an important part in terms of diagnosing. Now what we see with affective instability, it's otherwise known as emotional dysregulation, is it's really made of several other factors. And we think these factors kind of not only make up emotional dysregulation, but could also be associated characteristics. So when we see affective instability, we would also see other types of symptoms, like difficulty in identifying emotions, an increased sensitivity to emotional stimuli, an unusually strong emotional reaction, and frequent occurrence of what we call complex emotions. And really this is when somebody is experiencing more than one emotion at the same time. That's thought to occur more with borderline personality disorder than we see with a lot of other disorders. So I mentioned that affective instability is important to a number of clinicians diagnostically, but it's also, for some researchers anyway, apparently a key etiological factor. So what etiological means is something that's causal. So if a factor is etiological, we think it causes or contributes to the development of a disorder. And many researchers seem to believe that affective instability is a key developmental factor that kind of indirectly and sometimes directly leads to borderline personality disorder. It leads to a more expansive style of affective expression as well. So we see that this emotional dysregulation piece, this affective instability piece, is really crucial in a lot of ways. Now this brings me over to crying behavior. With all this in mind, it kind of makes sense that affective instability would be tied to crying behavior. So the crying behavior would really be a consequence of emotional instability and that hyperreactivity I talked about. So the particular study here that looked at crying behavior, the main one that I referenced, really looked at crying frequency, crying proneness to both positive and negative situations, an awareness of the impact of crying on other people. So are people aware that their crying behavior affects other people? A degree of control over crying, and the ability to inhibit crying. So all these factors of crying, all these angles of crying, were examined in this study. So what we really learn here is that crying is amazingly complex and has many aspects to it. And we would also expect, in terms of findings, when we examine a population and look at crying behavior, that a lot of these factors would more or less kind of line up. So if somebody's crying frequency was higher, we would expect their proneness to cry to be higher. We'd also expect that they would have less control over crying. So it would make sense, again, that these variables would more or less move together. So with all this discussion of crying and borderline personality disorder, how do we define emotional crying? So emotional crying, technically speaking, is shedding tears from the lacrimal apparatus, right? So the tear duct system, in the absence of any irritation in the eyes, and it's often accompanied by vocalizations, sobbing, and increased activity in some of the facial muscles. That's the technical definition. Only human beings cry with tears in response to both positive and negative emotional events. So the type of crying we see in human beings seems to be different than what we see in other organisms. So outside of the technical definition of crying, of course, we also believe there's an important element here around the functioning. So what's the functioning of emotional crying? Well, in human beings, it's thought that crying really serves intra-individual and inter-individual functions. So on the intra-individual functions, we see catharsis, emotional recovery, mood enhancement, so feeling better, and relief that would occur maybe after crying. But interestingly, the evidence does not really support this idea that catharsis, specifically in crying, leads to mood improvement. We actually see that the effects of crying really depend on how the tears are interpreted by other people, how other people react to somebody who's crying. So this brings us to the inter-individual function of crying, which seems like it's much more important than the intra-individual function. So what we see here is that the assumed benefits of crying are more likely a result from positive reactions from other people. So crying alone may not help somebody feel better, but crying in front of others may help somebody feel better. So again, intra-individual versus inter-individual. Now, we know that in front of others, in social situations, that emotional crying promotes the inhibition of aggressive impulses in observers. So if somebody's crying and other people are looking at that person crying, those other people are less likely to be aggressive toward that individual who's crying. We also see that emotional crying stimulates empathy and prosocial behavior in observers. So it compels people around the person who's crying to demonstrate caregiving and protective responses. So really, it facilitates social bonding. So that's the effect of emotional crying. Now, that's kind of a positive effect, but there's also a downside to emotional crying. If emotional crying is thought of to be manipulative, so if somebody looks at a person who's crying and they believe that they're faking it, they're lying, or that their crying is inappropriate, it may actually work the other way and elicit an anger, frustration, or aggression response from other people. So it can really go both ways. Usually we think of the kind of caregiving and protective response, but there is a negative response that's a possibility too, depending on how, again, the crying is interpreted. Now, crying behavior also has its own set of associated characteristics. We see it's associated with a high level of neuroticism on the 5-factor model of personality. We see it's also associated with high empathy and anxious attachment. Now, avoidant attachment is actually associated with low crying frequency. Now, when it comes to depression, depression is fairly interesting in terms of its relationship with crying. A lot of clinicians believe that when people are depressed, they're more likely to cry. But the research actually indicates that the loss of capacity to cry is a better indicator of severe depression. And we see this fairly often with people who have major depressive disorder. They actually reach a point where they can't cry. They'll say that. They say they really can't seem to cry anymore and they wish they could. So in a sense, they're like out of tears. That's the expression I've heard many times with major depressive disorder. So we have to be careful not only with borderline personality disorder, but with a lot of disorders in terms of looking at crying and thinking that it points to particular types of psychopathology. So now looking at this question of borderline personality disorder and emotional crying, and we can ask, why does this matter? Why is this important? Well, we see this theory that borderline clients are hyperreactive. We see that several studies have failed to demonstrate this hyperreactivity, which is kind of a surprising finding because we look at borderline personality disorder and we think, of course, it's associated with hyperreactivity. So this question is important because it might give us some insight into whether this hyperreactivity really exists, because there's this association between hyperreactivity and crying. Now, we also see with borderline personality disorder that borderline clients don't exhibit greater self-reported emotional reactivity compared to those without borderline personality disorder. So this is kind of interesting too. Borderline clients don't see a difference between themselves and people who do not have borderline in terms of how emotionally reactive they feel. So again, just kind of more evidence that the hyperreactivity theory might not be correct. Another reason this question is important is in terms of diagnosis, right? A lot of times, diagnostically, we do look to associated features instead of the symptom criteria for the disorder, which of course is a bad practice, and clinicians do need to focus on the actual symptom criteria more. But the associated features are important, and a lot of times people make decisions based on those. For example, if you're working with a client and the only thing you really know about them in assessment, the beginning of assessment, is they've been fired from a number of jobs. So they had a job for a week, and they were fired. They had another job for a month, and they were fired. And this pattern exists over a long period of time. Of course, this is non-specific. It might mean nothing. But for a mental health clinician might think about antisocial personality disorder, narcissistic personality disorder, substance use disorder, bipolar disorder. A lot of disorders have this construct of being fired from a lot of jobs as an associated characteristic, but not necessarily one of the symptoms. Another example would be if somebody doesn't make eye contact. Again, this could be cultural, it could mean nothing, but it could also point to schizoid personality disorder, avoidant personality disorder, or major depressive disorder. So again, associated features or associated characteristics are important, and we see that crying is an associated characteristic with borderline personality disorder, at least in the minds of many mental health clinicians. So it's important we understand this relationship between crying and borderline personality disorder to make sure that we're giving accurate diagnoses. If we misunderstand this relationship, it could lead to misdiagnosis. So what were the results from this study that looked at crying and borderline personality disorder? What did we actually see in terms of this relationship? Well, in this study, we saw that there were 3 groups. I already talked about the borderline clients group, right? These are individuals with borderline personality disorder. There was a non-client group, so these were individuals who did not have any personality disorders. And then there was a group comprising individuals who had cluster C personality disorders, again, avoidant dependent and obsessive compulsive personality disorders. So I'm just going to refer to this group as the cluster C clients. So what we saw here is, compared to the non-clients, the borderline clients reported higher crying frequency, but a similar proneness to crying in response to both negative and positive stimuli. and similar levels of inhibition and control. So looking at this finding, of course, this doesn't really seem to make sense based on the theory that we have. All these variables should move together. So if crying frequency increases, the other variables should be changed accordingly, but that's not what we saw in this study. And I'll explain this finding in a moment. We also saw in terms of finding that borderline clients reported a lower awareness of the interpersonal effects of crying as compared to non-clients. So they didn't really seem to be aware of how their crying affected other people. And then the last key finding here in the study was that the borderline clients did not seem to be any different than the cluster C clients in terms of crying behavior. So really, 3 findings that were fairly surprising. So what do these findings mean? Well, the combination of higher crying frequency with the comparable levels of the proneness and inhibition of crying, again, don't seem to make a lot of sense. We would expect higher crying frequency to specifically be associated with a decreased inhibition and decreased control, as well as higher crying proneness. So what these findings really suggest here is that the borderline clients might be exposed to more emotional situations or create more emotional situations that would lead to crying as opposed to non-clients. Now, another thing that could be happening here would be that borderline clients perceive or experience emotional situations, including conflicts and other relational situations, more intensely than non-clients. So that's another potential explanation here for these findings with the crying behavior. So what might be happening here is that borderline clients might not necessarily be more emotionally reactive, but rather perceive situations as more threatening or distressing. So it might be a matter of perception as opposed to emotional reactivity. Now, this is an important finding, of course, because affective instability, that emotional reactivity component, is a crucial symptom criterion for borderline personality disorder. So how about the meaning of the finding about the lower awareness? Borderline clients were not aware the effect that they were having on other people through their crying behavior. Well, this finding seems to really run contrary to the popular notion that when individuals with borderline personality disorder cry, they're doing so, at least in part, to be manipulative. It actually seems more likely that there's a lack of insight here as opposed to a deliberate attempt to manipulate somebody through crying. I find this to be a particularly interesting finding in the study because a lot of times when we look at personality pathology, we look at cluster B personality disorders, we know that manipulation is a symptom or an associated characteristic really with all of the cluster B personality disorders. So this would include, of course, not only borderline personality disorder, but antisocial, narcissistic, and histrionic personality disorders. And there's a lot of debate and speculation about the degree to which people understand when they have those disorders that they are manipulating people, the degree to which it's intentional, and really how much insight plays a part in terms of that intentionality. So somebody could have an objective in mind and they could be manipulating, but they might not really understand the nature of the manipulation or be 100% responsible for that manipulation. Because again, that lack of insight is really kind of obscuring the situation for them. So are some of the manipulative behaviors in cluster B personality pathology deliberate? Of course, but some of them aren't. And when we look at borderline personality disorder and crying specifically, if somebody with this disorder is crying and they're not really aware a lot of the time of how people perceive that, how people see that, that really kind of indicates that they're not being manipulative, at least in the context of crying. They don't really understand how that affects other people. Now, of course, there could be instances where somebody's crying and they have borderline personality disorder and they do understand the effect of that crying. That can still happen even if the tendency is that that's not what's happening. So again, just kind of an interesting finding because much of the time we're really looking at cluster B personality pathology and trying to understand the nature of manipulation, and this finding speaks directly to one part of that, borderline personality disorder specifically. Now on to the last finding, which was we didn't really see a difference in crying behavior between borderline personality disorder and cluster C personality disorders. I thought this was particularly surprising because if you have different clients in front of you and you're assessing them and someone's crying, most mental health clinicians, again, would sort of think, okay, that must mean that borderline personality disorder is more likely? Well, as it turns out, crying doesn't help differentiate between borderline personality disorder and any of the cluster C personality disorders. So this is really helpful, I think, for mental health clinicians, again, when looking at clients and thinking, how should I weigh the crying behavior? How important is that behavior, and how helpful is it in terms of a diagnosis? How helpful is it in terms of differentiating one diagnosis from another? So I know whenever I talk about borderline personality disorder and these other personality disorders and the characteristics of these disorders, there are going to be a variety of opinions, people who agree or disagree with me. Please put these opinions in the comments section. They always generate a really interesting dialogue. As always, I hope you found this description of borderline personality disorder and crying behavior to be interesting. Thanks for watching.